Dinshan, thank you very much for the introduction. Now, for the next 40 minutes, I'm asked to fulfill two. The public and the relationship with the external public is extremely important to become a good communicator and a good doctor. Public relations public relations definition of a public relation. There are many definitions of public relation, but I like this because this is somewhat closer to what we do. Public relation is a planned and sustained effort to establish and maintain goodwill and mutual understanding between an organization and its public. So planned and sustained effort to establish and maintain goodwill and mutual understanding between an organization, that is your hospital, and the public. So who is this public? So we get patients. Nowadays, we call them clients rather than patients. Then we have your relations or bystanders. Then there are community leaders, political leaders, religious leaders, and community members. Now, you have been working, as I understand, you have been working for 1.5, quite a bit of experience dealing with the public during this as a post intern and as a house officer. And you have, this past year also has been very challenging to the medical sector as a whole, and doctors in particular, because of the COVID pandemic. It has been very difficult to maintain relationships with the public, very challenging to maintain relationship with the public with the current situation. We can't, unlike those days where you get a patient, you don't think whether you are going to catch anything from the patients, and you go all out, talk to the patient, building up a relationship with that patient. But nowadays, when the patient comes, we always have to think. I work in a high risk area, the Beirul. So I have instructed my staff to consider every patient as a COVID patient. So in that sort of sense, it's not easy to maintain like sort of a normal relationship, but in the new normal also, this public, external public, and the maintaining a relationship with the external public is extremely important. All these categories, clients, relations, bystanders, community leaders, political leaders, religious leaders, community members, that the need to maintain good external public relationships has become even more important within the current context. So public relation is a responsibility of an organization. As an institutional head, it is my main concern how my organization is perceived by the public, how my organization is seen by the public. And then PR is a responsibility of an individual also, how I am perceived by the public, how I am seen by the public as a doctor, as an administrator. So as a doctor working in the periphery, you have both these responsibilities. As an organization, I can say, simply say, public relations involves a variety of programs designed to promote and protect institutional image. I'm sure during the past year also, you must have participated and done some of these activities where we administrators consider important to build up an organizational image. For example, community health education and health promotion programs where you go out, do lectures, talk to people, teach them. I know it has been not been easy during the past year with the COVID pandemic, but still, I know some of our organizations do that. And then PR promoting activities, we all do Bhakti Geeta, stage dramas, cultural events, spirit chanting events, all that. And there are some organizations or committees within hospitals where you can use to promote public relations. Like now, Hospital Development Committee, Suvaseva Mitro. Now it's a new committee. Some of you may have heard where it is a part of this PSSP, new PSSP project. And then you can produce small newsletters, brochures, catalogs. Like all this, when you become an administrator, all this is part of your daily work. You think of this because you want your organization to be perceived as a good organization, public friendly organization. But the administrator cannot do it alone. You have a huge part in this. So when it comes to organization, public relation, what I want from you, what I plead from you is join these activities, help these activities. Because when your organization is perceived by the public as a good organization, you as a person will also be perceived as a good doctor. So who is a good doctor? Good doctor should be a good healer. There is no two words about it. People come to a hospital to take treatment. People come to a hospital to get well. So your primary job is to make the patient well and please feel the patient comfortable. So once you do that, then you have to ask the question, are all good healers good doctors? In some of the places I work, in the OPD, in front of one room, it's a long queue. Everybody wants to go to that doctor. And if you ask that person, ask those people, why you want to go to that doctor? The answers you get is not that ඒ ડોક્ટર හොඳ වෛද්‍යවරයෙක් නැත්නම් දක්ෂ වෛද්‍යවරයෙක් අපිට බෙහෙත් දුන්නාම හොඳ වෙනවා. But the more common answers you get is he's a good listener. කියන දේ අහන් ඉන්නවා. He's a kind person. He treats us well. Kind person, he treats us well. So those are the things that we hear. So good doctor does in the eyes of public, a good doctor is not necessarily just a good healer. There should be other qualities also. I have put this. This is a nice verse which I think in some sense summarize what I'm trying to tell you. It says, ලෙඩ වෙච්ච පපුවස්ස උනත් හිත් ගැහෙනවා, බෙහෙතකට වැඩි යමක් එහෙම හිත් හොයනවා. මේ ලෝකේ සමහරක් සිනහවල් තියෙනවා, දැක්කහම ලෙඩ වුණත් භාගයක් නිවෙනවා. This is a big part of what your public wants from you. Be friendly. Talk to them friendly. Treat them with dignity. Think like this. If one day, if you are the patient and if you go to a doctor, there is a certain way that you want that doctor to treat you. You want that staff to treat you. You want that nurse to treat you. And treat your patient the same way. Everybody wants to be treated with dignity. Don't shout at patients. Don't use degrading words because they are human beings. They have their own problems. They have their own worries. Sometimes when I was a child, we may have had this feeling also. When you go to a doctor, when you are ill, when you go to a doctor, even without taking a single drop of medicine, you feel well. That is the power that you have. Use that power well. Use that power to make them feel better, make them feel good about themselves, make them feel good about you. So treat them with dignity. Third thing is ensure confidentiality. Confidentiality is something very important. Don't share anything that they tell in private. And autonomy. Make sure that their wishes are also considered. Then show empathy. Empathy is seeing something from their point of view. Put their shoes on and see as they see them, and try to provide their needs without undue delays. And in your wards, sometimes the patient's relations may want to bring a priest to talk to the patient. Let them do that. Maybe they want to give some piritvatur. Let them do that. Those are important. Those are cultural beliefs that we should respect. So remember, there are no rules in public relations. There are no limits in public relations. You create your own style. PR can be easily learned and developed, but you need to want it. Now, I heard Dr. Mahesh talking to you about getting your postgraduate degrees, developing your careers. So you will get wings. Your wings will be stronger and stronger in the future, and you will be able to fly farther and farther, right? And when you do that, remember, nobody is perfect. You will make mistakes, but always try to be the best version of you. Always try to do the best you can. And don't ever be afraid to say sorry and change. With that, I would like to go to my second part of my lecture, which is called patient-centered communication in medical interview. This is some of you may have heard about this patient-centered communication. Some of you may not, right? When we passed out, I passed out in 1997. I did my internship at Kaluvavil Hospital. When we passed out, when we were young, the doctors held a different stature in the society. We were treated like gods. Whatever we said was God's word, and everybody believed it. And we had this idea that people have to listen to us. They have to believe us. No questions asked. But now it is different. Now things have changed. There are a lot of information for the patients to get, and they know about disease. Medicine is no longer a magic. And what the position that doctors held during a medical interview as the centerpiece of that medical interview has changed, and the focus has shifted to the patient. So now the medical interview is and should be led by the patient, which is called the patient-centered interview. Medical interview is the most common undertaking by a doctor. Despite many advances in technology, the medical interview remains the most valuable method of sharing information. There are PET scans, CAT scans, all those sort of scans, but still, medical interview is where you gather most information to come to a diagnosis. The main purpose of the medical interview are four things. One thing is you encourage the patient to talk, get most information from the patients, and then you listen to what the patient is saying. And by listening and making the patient give you information, and then you gather information. And when you gather information, then next step is you go for a diagnosis. It may be a provisional diagnosis, maybe a definite diagnosis. Whatever it is, you go for a diagnosis, and then next step is to provide information. Those are the four most important things in a medical interview. Patient-centered interviewing, where the patient holds the center stage, provides the best opportunity to accomplish these aims. Some of us are better communicators than the others, but all of us can benefit from some knowledge and practice of patient-centered communication skills. I have divided the medical interview into several parts: initiating the session, nonverbal communications, open and close questions, repetition and paraphrasing, understanding the patient perception and feelings, summarize the and closing the session. So we will start. First thing whether it's your PP or whether it's your OPD, whether it's your hospital or ward, there should be privacy and confidentiality. Other people should not be able to overhear what you are talking with the patient. I know it's difficult, especially in the OPD, but try to make this as private and confidential as possible for the patient and for yourself. And there should be no physical barriers between. Sometimes I see huge handbags kept between you and the patients. It's very difficult for the patient to see you and show you. No physical barriers. It's better even if there is no table in front of you and the patient. And then there should be less noise and complete attention should be given to the conversation. Do not use your cell phone when you're having a conversation with the patient. Switch it off if possible or mute it. Right. We will see this video and then we will discuss that. This is about initiating a session.
Hello.
Hello.
Hi, are you Celia?
Yeah.
Hello, my name's Emma. I'm one of the doctors, and I've been asked to do a chat with you to check up on how things are going with your diabetes. Is that all right?
Yeah.
Who have you brought with you? Is this your
My mum.
Okay, is that all right with you?
That's fine.
So I'll ask you a few questions about how things are going and about when you were first diagnosed, and then we'll make a plan if anything needs to be done today. Okay?
Yeah.
If it's all right with you, I'll just make a few notes as we go along.
Yeah. Good. Hope you saw the video because I didn't. Now there are some salient points I want you to notice in that video. First, the doctor said hello, greeted the patient. So that is important. When a patient comes in, when you see the patient, okay, right. They want to share the video again. Let's see.
Hello.
Hello.
Hi, are you Celia?
Yeah.
Hello, my name's Emma. I'm one of the doctors, and I've been asked to do a chat with you to check up on how things are going with your diabetes. Is that all right?
Yeah.
Who have you brought with you? Is this your
My mum.
Okay, is that all right with
Yeah,
you?
that's fine.
So I'll ask you a few questions about how things are going and about when you were first diagnosed, and then we'll make a plan if anything needs to be done today. Okay?
Yeah.
If it's all right with you, I'll just make a few notes as we go along.
Yeah.
Okay. This time I'm sure you saw it. Yeah. I want you to compare your discussion with the patient, initiation of your discussion with the patient with that. First thing she did was she greeted the patient. She said, hello. Like in our culture, you may not need to say hello to every patient. Right? Smile. Smile does not cost anything. Smile. When I did private practice, when a patient comes in, the first question I asked was, "Ada මොකද මේ පැත්තේ?" Use something like that. Build up your own greeting. Then another thing she did was she addressed the patient by name, asked what the name was and addressed the patient by name. I know in our culture we address the patient using many names. We say Akka, Iya, Amma. I suppose in an Asian culture that is all right, but make sure the patient is comfortable with that. Otherwise, you have the patient's name with you. It may be Siripala, Gunapala, Samarasekar, or whatever you call that, Mr. Samarasekar, Mrs. Gunavati. The patient will feel comfortable about it. And then the doctor introduced herself. Introduce yourself. Tell that I'm so and so, and I'm the doctor here. And today, I would like to talk to you about your illness. So she explained the purpose of the interview, especially when it comes to a long history taking session. It's better to have some boundaries at the start of the, and then take consent from the patient and the guardian. That is something we never do, but we should learn how to do it. And then another important thing is she asked the patient if it is okay to take notes. So she said hello. She addressed the patient by name and she introduced herself, explained the purpose of the interview, took consent from both the patient and the guardian, and asked the patient if it is okay to take notes. So that is the initiation. Then you start taking the history. Opening question. What should be the opening question? Let's do it.
If it's all right with you, I'll just make a few notes as we go along.
Yeah.
Right. How old are you, Celia?
I'm 11.
11. Okay, great. Okay. So tell me a bit about how you're doing at the moment. How is things going?
Because I've got my pump,
Okay.
my blood sugar's been mainly okay, and I've had a few high ones,
Okay.
but not regularly.
Okay. Very good. If it's
I don't know. Okay. Hmm? Right. There are two main types of questions. One thing is open-ended questions and closed-ended questions. Here, she started asking, how old are you? That is a closed-ended question. If the person can give an answer with a single word, yes or no, or any other single word, that is a closed-ended question. Then she asked, tell me a bit about your illness. So you can't say yes or no or one word when you ask that sort of a question. So that is an open-ended question. Open-ended questions is meant to get more information. So in a medical interview, once you start the medical interview, it should not be only closed-ended questions and it should not be only open-ended questions. It should be a mixture of that. A clever mixture of open and closed-ended questions should be there. Then I go to another most important thing, a non-verbal communication.
doing at the moment? How is things going?
Because I've got my pump,
Okay.
my blood sugar's been mainly okay, and I've had a few high ones,
Okay.
but not regularly.
Okay, very good. When were you first diagnosed with your diabetes?
I was diagnosed on the, I can't remember.
It's alright, Mum can help with some of these
I
ones.
was
Say how old you were.
When I was 6, I had turned 6, I think, only a few days early.
So she was 6, okay, fine. And you, it might be a bit much to ask you to remember, but I might just ask Mum if you don't.
Okay. Now, nonverbal communication is a very important part of any communication. When you are talking to a patient, the patient continuously watch your expressions, watch how you sit, watch how you use your hands, keep your hands. And you also watch the patient. And sometimes you learn more through these nonverbal cues than verbal words that they use. Now, when you sit, when you're talking to somebody, if you want to feel close to that person, if you want that person to feel close to you and trust you, make sure that you lean forward a little bit, like that doctor did. Sit while leaning forward. And then eye contact. Make sure that you have you and the patient is at the same eye level. If you are sitting down, patient should be seated. And then you encourage the patient by things like nodding your head. Okay, right. Small things to encourage the patient to talk. So I want you to see that, watch that video again a little bit to appreciate what I just told you. Hold on, the same video.
Mind what was happening at that time for her to be diagnosed.
There were a few signs. She was becoming.
So tell me a bit about how you're doing at the moment. How is things going?
Because I've got my pump,
Okay.
my blood sugar's been mainly okay, and I've had a few high ones,
Okay.
but not regularly.
Okay, very good. When were you first diagnosed with your diabetes?
I was diagnosed on the, I can't remember.
It's alright, Mum can help with some of these
I
ones.
was
Say how old you were.
When I was 6, I had turned 6, I think, only a few days early.
So she was 6, okay.
Right. Then you continue having a conversation and you want to get as many information as possible. There are 3 other things I want to emphasize. I want you to learn. One thing is repetition, paraphrasing, and signposting. Talk about signposting first. Now, when you go on a road, you see a lot of things. If you take the highway, you see this is Khathudu exit, this is Omagam exit. And then you know, if you take that road, you will exit and go to Omagama or Khathudu. Those signposts show you the way. Just like that, in a conversation also, you can put signposts to ensure that the conversation leads to where you want it to go. Sometimes when you start talking to patients, sometimes when you, especially elderly patients, sometimes they tend to take their conversation the way they want, the way they want. Like if you want to talk about their cough and they want to talk about their leg pain or joint pain. So what you can do is you can just say, Amma, අපි අර කැස්ස ගැන පොඩ්ඩක් කතා කරමු. So you show a signpost that you want that conversation to go that way. And then you repetition paraphrasing. Similar. You repeat what the patient said. For example, you say, තද ඔළුව කැක්කුමක් තිබ්බ කිව්වා නේද? මට පොඩ්ඩක් ඒ ඔළුව කැක්කුම ගැන කියන්න. So you repeat what patient has said. තද ඔළුව කැක්කුමක් තිබ්බ කිව්වා නේද? That's paraphrasing. Paraphrasing is you don't use the same word that the patient say, but you say it in your own words. Patient has said, මට හිස කැක්කුමක් තියෙනවා. You say, මට ඔළුව කැක්කුමක් තියෙනවා කිව්වා නේද? චුට්ටක් අපි ඒක ගැන කතා කරමු. So that shows two things. One thing is that shows that you are listening to what the patient is saying. You are hearing what the patient is saying, and it is important for you that to hear that. It's important what the patient is saying. So that builds trust. So repetition, paraphrasing, and signposting will take you in the direction that you want and gather the information that you want. And there is another thing. This is something that I want to emphasize very much. That is, patient is a human being. As I said earlier, he has worries. He has. Now, patient may have kept her children at the neighbor's place and come to you. And then you ask the patient to get admitted, which is impossible. And patient says, I can't admit. You say, කරන්න දෙයක් නෑ. ඔය ලොකු අමාරුවක් තියෙන කෙනෙක්. ඔය ඇඩ්මිට් කරේ නැත්නම් මට කරන්න දෙයක් නෑ. No, you need to see that patient beyond the signs and symptoms. See the person behind that, the person with all these problems, all these worries, right? So that is very important. And then providing information. When providing information, we call it something called chunks and checks. You provide information, chunks can kuttiyak dila, you check whether you have got the kuttiya. You say give some information. මේ බෙහෙත බොන්න දවසට 3 පාරක්. කැමට පැය භාගයකට ඉස්සෙල්ලා. වතුර ටිකක් එක්ක. And then you ask the patient, "අම කියන්න මේ බෙහෙත ගන්න කොහොමද?" And make sure that the chunk you have given to the patient has checked. Patient has taken it. You give a chunk and check. Right. Finally, you need to summarize the conversation. You need to summarize the conversation. You need to tell, "Amma, මෙන්න මේ අමාරු තමයි ඔයාට තිබ්බේ. මේ අමාරු තමයි ඔයාට තිබ්බේ." Right? මම හිතනවා මෙන්න මේ විදිහේ දෙයක් තමයි මේකට අපිට කරන්න පුළුවන්. මේ බෙහෙත් ටික අරගන්න. In few seconds, you summarize the whole conversation that you have had. So we will end there. What I want you to now, you are at the beginning of your career. You are at the beginning of your career, right? And there's a long way for you to go. And what I want you to know is, now being a doctor is not just being a good physician, good healer. Being a doctor is being a good human being, understanding human being. To do that, you must understand that the patient or the relation or the community leader or the religious leader or the political leader, for that matter, is another human being. And they deserve respect, dignity, confidentiality, and they deserve to be treated as another human being just like you. Thank you very much, and I hope you have a wonderful, fruitful, and successful career. Thank you very much.